И мы продолжаем с нашей первой презентации. Те из вас, кто были на летних и зимних школах, знают Ідо Hadari, который директор по вопросам коммуникации и связи с правительством службы здоровья Maccabi Израиль. Я у себя не знаю, буду слышать перевод или нет, но у нас синхронный перевод будет. Наверное, я его тоже буду слышать у себя в ухе. Мы еще не все поняли, как работает перевод в Zoom и как вообще до конца работает Zoom в таких ситуациях. И у Ида будет несколько слайдов, и вы увидите ролики, наверное, в комментариях, да, Юлечка, или прямо на экране. Вы увидите ролики и в эфире, и увидите ролики потом у себя в комментариях, полезные для вас. А остальное у нас все будет происходить в таком живом диалоге. Поэтому начинаем. So, Ido, you go ahead, and the interpreter is following you, and I am following you. So, you start.
Thank you, and hello, everyone. Usually I come to Ukraine, but now it's impossible, so I'll do it from home. We are facing the same challenges now. All the world is in the same war against the COVID, and all the northern hemisphere is also fighting the flu.
Я не слышу переводчика. Ребята, кто-то слышить переводчика?
Я перепрошую, да. Зараз чуєш? Алло, привіт.
Олег, зараз я тебе чую. Привіт, давай, бо
Все,
втрачаємо час.
дякую. Сорі. Алло.
Ido, continue.
Будь ласка, прохання, щоб я запустив екран для всіх. Зараз ми йдемо далі. Пару слів, звідки я. Ми надаємо медичні послуги. Десь 2,5 мільйонів громадян в Ізраїлі отримують наші медичні послуги. У нас є десятки тисяч пацієнтів, які захворіли вже на коронавірус. Це лікарня Maccabi, і ми більше надаємо лікування вдома. Лише 2% наших пацієнтів госпіталізуються, а решта наших пацієнтів, 98%, вони залишаються
there. Most of them are with very light symptoms, and the ones that have more than light symptoms are getting treated by our staff.
Отримують лікування нашим персоналом.
Can I ask you straight ahead to clarify one small thing? Are they not
Одне
getting
невеличке
hospitalized?
питання.
Are they
Тобто
all
їх
being
не
treated at home?
госпіталізують?
Yes, 98% of the patients in Israel are treated.
Пацієнтів в Ізраїлі, вони лікуються вдома, і вони взагалі не госпіталізуються. І набагато краще буде пацієнтам, і буде набагато краще самій системі, а також і їхнім рідним та близьким. Більшість наших пацієнтів не потребують будь-якого медичного лікування, їх треба просто спостерігати. Добре, можу я далі продовжувати? Да. Я просто чекаю синхронний переклад, тому я... Добре. Отже, я думаю, десь починаючи з травня чи червня, ми багато зусиль докладаємо до підготовки до зимового періоду. Через те, що ми розуміємо, що у нас будуть подвійні завдання, буде сезонний грип, а також буде нашарування COVID-19. Нам треба зрозуміти, ми вже збагнули, що нам треба підготуватися до того, що буде великий наплив пацієнтів, будуть десятки тисяч пацієнтів будуть до наших медичних центрів звертатися, і так трапляється щозими, але тепер у нас будуть вже міксовані пацієнти, буде змішані симптоми. Коронавірусні пацієнти будуть, а також пацієнти з грипом, а також нашаруються будь-які інші віруси, які характерні для будь-якої зими.
Continue.
Також ми розуміємо те, що що половина нашого персоналу може також перетворитися самі на хворих, на пацієнтів. Багато із них інфікуються цим вірусом, або вірусом грипа, або вірусом ковіда. Вони інфікуються, і нам не вистачає медичного персоналу. Ми хочемо з свого боку забезпечити, що ми не будемо наражати свій персонал на позитивних пацієнтів, якщо немає такої потреби.
Continue. Just don't stop, just continue.
Okay, I'm stopping just for the translator.
But not for such a long pauses, just continue.
Okay. The third part is we are
Третя частина в тому, що у нас карантин оголошується, локдаун. Ми зараз намагаємося вийти із другого локдауну в Ізраїлі, і для нас це нелегко. В рамках цих локдаунів то у людей немає громадського транспорту, який працює. Певний період часу вони не можуть зустрічатися із батьками або з іншими рідними та близькими. Отже, дуже важко забезпечувати медичні послуги літнім людям або таким пацієнтам, які вже залежать від роботи громадського транспорту. І суть полягає в тому, що у нас є звичайні проблеми охорони здоров'я. Ми мусимо збагнути, що є діабет, є рак, а також решта захворювань, які далі тривають навіть на тлі коронавірусу, і нам треба надавати лікування своїм пацієнтам також інтенсивно. Ми не мусимо допустити, щоб наші пацієнти спадали дані у хронічні захворювання. Значить, хронічні захворювання у рамках локдауну – це дуже серйозне питання. І, звичайно, щеплення від грипу – це наш наступний пункт. Наш медичний центр Maccabi, ми торік
Stop for a sec. I have a question to you.
600 тисяч наших пацієнтів отримали щеплення від грипу торік.
Before we go to the immunization
Перед
of
тим, як
influenza
ми
immunization,
будемо говорити про щеплення від грипу,
the lockdown, why
от сам локдаун,
and for what is the
чому
lockdown?
і навіщо
Are you
проводиться
unfolding the
локдаун?
beds this time? Are you
Тобто ви
buying more
розгортаєте
oxygen?
койко-ліжка,
So
чи ви
what are you doing
закупаєте
during the
кисень
lockdown?
ще більше в обсягах? Що ви робите в локдауні? У локдауні, по-перше, це для того, щоб намагатися стримати розповсюдження захворювання, щоб воно більше не розповсюджувалося, і ми намагаємося, ми називаємо це літера А. Тобто це наш коефіцієнт нерозповсюдження. Якщо кожен громадянин буде передавати вірус більше, ніж одній людині якійсь, тобто одній чи двом, це означає, що вже вірус буде зростати, епідемія буде зростати. Ми мусимо зробити оцю літеру А, це у нас так називається, менше одного. Це означає, що один пацієнт не буде передавати вірус ще якомусь одному іншому пацієнту, і тобто він буде передавати менше, ніж одному пацієнту. І під локдауном мається на увазі, що ніяких шкіл, ніяких весіль, ніяких торгових центрів, ніякого громадського транспорту, ніякого футболу. Отже, всі збіговиська забороняються, і зборище теж. Якщо я не можу ні з ким зустрічатися, то я не зможу тоді вже нікому передавати цей вірус. Коли у нас був перший локдаун, у нас було дуже багато роботи, ми були дуже сильно занепокоєні тим, що нам не вистачить кисню. Ну, принаймні, що нам не вистачить вентиляційних апаратів, однак у нас зараз їх достатньо. Однак ми думали, що кількість, рівень інфекційних людей, які можуть передавати інфекцію, дуже високі. Зараз дебат на рівні Ізраїлю, те, що Кабінет міністрів вирішив, що в неділю будуть відкриті гастрономи, тобто не торгові центри, лише оці гастрономи, щоб люди могли скупитися. І Міністерство охорони здоров'я над цим працює. Отже, ми мусимо працювати над тим, щоб не допустити, щоб захворювання піднімало свою голову. Ми хочемо підтримувати теж свою економіку і звичайне життя громадян.
Katya, can I go forward to the flu?
Катя, я можу переходити до вакцинації від грипу?
Yes, you can.
Можна.
So last year,
Минулого року Макабі прищепило від грипу 600 тисяч пацієнтів, і цього року ми хотіли закупити трошки більше, ніж 1 мільйон доз, тобто і ми десь 900 тисяч змогли закупити одиниць, і ми вважаємо, що цього забракне нам. Це означає, в свою чергу, що минулого року у нас було 600 тисяч прощеплено, а цього року ми будемо щепити 900 тисяч.
the vaccination is open to everyone. If you come to the clinic, you get a vaccination. This year, we started only with 75 or more, and then after we finished with them, we went down to 65 and more, and to chronic patients, pregnant women, kids in a certain age, and people that are healthy and young wants also to get a vaccination, and we are not giving it yet. We want to see the whole target group get vaccinated and just then give it to the regular patients.
Ido, do I understand you right that your priority group is 75 plus and healthcare workers or not?
Our priority groups are 65 plus, chronic ill patients, pregnant women, kids at 6 months to 12 years, if I remember correctly, health workers, of course, actually first responders as a whole, also policemen, army, courts, etc. This is the main target audience that we have. The second level will be, together with the all public, will be also people working with elderly or people that have in their families someone with immunosuppressed system. Okay, so there are some solutions for the situation. I don't want to be sound too pessimistic. We found out that patients can change their attitude, and also the health personnel can change their attitude. And we started giving much more telehealth medical services. And during the last winter, around March and April, 80% of our services was given either by telephone while the doctor speaks to the patient, or by digital means. Only 20% of the medical services was done face-to-face. It's an amazing transform from the routine and normal and regular way. So we let the patient ask for an appointment in the doctor's diary and in his diary for Monday at 10 o'clock. Then on Monday at 10 or 10:15, the doctor calls the patient from the system, not from his cell phone, of course, and do the visit and types everything on the main computer. And only if the doctor thinks that the patient needs to really come and get a face-to-face service, they do it. But again, 80% of the services was given by telephone. The second point here is automation. We understood that many of the things that we do manually can be done automated. Even to get until recently, if you wanted to have a COVID-19 test, a PCR test in Israel, you have to have a referral from the doctor. But if you call the doctor and says that you have flu-like symptoms, then he gives you the referral. So we asked why. Let's do it automated. So you can call a telephone and there is like a voice questionnaire. You answer the questions, and if if you answer it correctly, then you get the referral and go and do the PCR test. It relieves much of the burden on our doctors, and it's much easier for the patient. So going automated can be very, very good. The third point here is keeping close contact with chronic patients. Since the corona is mainly for the primary physicians, family physician and pediatricians, of course, we asked many of the secondary doctors to get a closer look on the chronic patients in order not to let them go, or not to let the disease that they are suffering from raise its head. And the last point that I want to mention, and we will soon see a short videos about it, we understand that we have to separate patients. There are the people that are coming to do the PCR test. They are the suspected. We don't want them to be mixed with other patients. The second group is sick patient. If I'm coughing, if I have a stomach ache, it may be nothing, of course, but I don't want to mix a patient that is coughing with someone who came to get the flu vaccination, which may be chronically ill, but not now. So we have to separate the three groups. What we did is all the PCR tests are done not inside our buildings, but outside. The flu vaccination is given not inside the clinics, but outside. I will show you how. What we see on the right hand here, this lady, we created this booth. You will soon see it on a video. In this booth, the staff member can be without any protection and do the PCR test. The patient comes with an electronic card, like a membership card, and get the identification process done. And then we take the test, and it is put, the staff member puts it here in an ice box, and we take it each 2 hours to our main lab. So this is how we separate patients that are coming to do the test from patients that are inside the building, which is around here. These two photos is about flu vaccination. The first one is a drive-in. You don't get an hamburger, but you do get a flu vaccine. You stay in your car and you get a vaccine. It's working great, and we started just this year with this, and we get a lot of great feedbacks. This one is a mobile unit. We tell the patient, look, on next Wednesday, our mobile unit will be in your street or in your neighborhood. We want to schedule a meeting with you to get you vaccinated. And we come, we park, the patient comes, gets inside, and get a vaccination done. It helps us really reach the target audiences and give them the vaccination. Now, can you please show the videos? It doesn't really matter who will be the first. Okay, this one is the mobile unit for getting vaccinated. You can run it a bit further more.
Можно промотать немножко.
So they really park, and in a few minutes they can start giving the services. Again, especially in a large country like Ukraine, it can be beneficial for small villages or even for cities. the patient really have a very good feedback on what we're doing, and it's not very expensive to deliver. So this is the first video. Can you go to the drive-in, please? It's close to a stadium, a football stadium that we have.
The year of Corona forced us to think differently.
And it really works. I was there 2 weeks ago, and it looks great. You come with your car, you get identified. We schedule a meeting for you. You don't come on your own. We tell you when to come, and then you get vaccinated. It's a very short process. And after you get vaccinated, you stay for about 15 minutes. We want to see that everything is good with you and you don't get an antiseptic shock. So this is how it works, and it's really, really great.
Анафілактично, антисептично.
All our needs during this complex period of flu and corona.
We streamlined the immunization process
Sometimes
to the
if
minimum
patient
time,
wants to,
minimum
we can
contact,
let him come out and do it by the car.
The
but
site
if
operates
not,
from 8 in the morning till
it's
8
great.
in the evening and can inoculate more than 1,000 members a day. We set up the site because your health is what drives
This tent has 6 stations, and 6 stations do about 1,000
Without a
patients.
doubt, we missed
day.
having a crowd at the stadium. And thanks to the cooperation from Maccabi, we have a crowd again.
Okay, if you come to Israel, this called Sami Ofer Stadium. It's in the city of Haifa, in the northern part of Israel. So this is it. Okay,
Any eligible member can make an appointment, drive here in their car, and while still in their car, come to the nurses' station and be immunized.
okay. Now, 2 short movies about the corona. I'll share my screen again, and just a second, this one. Can you stop the one with the stadium, please? Okay, now about the corona booth, you can take a look at this one. Again, the staff member don't need to be protected since he's inside the booth. There are more than, I think, 100 booths like that in Israel. We developed it, and now even the Palestinian Authority bought 15 units like that. The patient comes, he gets identified. This one is a CNN reporter doing the test. Okay. And of course, he's doing also the nose. And then each tube is, of course, identified with a barcode, and then transfers to our main lab. Soon you will see the lab. Okay. And here you can see another development that we did. We don't use it yet, maybe soon we will. It's a portable unit. I can come to an apartment and do it, or to do it in a parking lot underneath an apartment building, and provide the patients with the tests. Okay, and now the last slot, if you can, the last video, if you can share, please. I will stop my share. The one from the COVID lab. This lab can do about 15,000 units per day. We developed it during the pandemic. We started with about 700 per day. it was
Не
like
доз
February.
образцов, 15 тысяч образцов ПЦР.
We have just one lab in Israel in our organization, just one lab. And all the tubes are coming from all around the country to this lab. And from the point or the time that we take the test, we take the swab, it takes us about 18 hours to come back with an answer. Everything is computerized and sent to the patient and also to the doctor and also to the Ministry of Health. So everything is automated and really, really working great. It's of course with the routine or the high standard of equipment. This is it.
Mhm. I have several questions to you. Not only from me, but as well from people who are watching this air.
Okay.
So the question is, who is paying for the mobile brigades of immunization? And who is paying for the PCR, these kiosks?
We developed it ourselves, and we understood that it's much cheaper for us to use it than to do any other solution. So we use it. We didn't get paid by the government for that. Usually we get budgeted per capita and not per project. And hopefully someday the government will come and ask us what were the costs and pay us some of it. But we are not relying on any money. We are doing it. It's not such expensive booth. I think that each booth costs about $5,000, which is not that expensive if it can deal with hundreds of patients per day.
Can you tell me what is the dynamic of immunization against influenza? When did you start immunizing and how many people are already immunized?
In Israel now, I think if I multiply our numbers, we're probably around 1.4 million people that already got vaccinated. The whole population in Israel is about 10 million. The pace is very good. It's not too much since the vaccination is not open to everyone. And we schedule the meetings, then we can keep our hands on the pace and not create too much lines or waiting lines for the vaccination. So we are doing about, in my organization, about 5,000 a day or 6,000 a day, but the numbers will soon rise up to 20,000 a day once we open the vaccination for everyone.
Do I understand you correct that you are vaccinating only by mobile brigades and never do it now inside of the health facility?
Yes and no. We are not doing it inside our clinics unless we do it in separate hours. Since we call them to come and get vaccinated, usually in each year, the people could come anytime they wanted, usually in the first part of the day. Now we invite them to come.
So if I understand you correct, the one way to get vaccinated is the mobile brigade, where the car comes to some place. The second way is to come in your own car and being vaccinated in your own car, like in McDonald's. And the third option is to come to the health facility in the hours where the health facility is ready to do only immunization, but nothing else, correct? Так, связь с Ида утерялась на время. Сейчас мы ее попытаемся восстановить. Сейчас, секундочку, ждем. Пока можете присылать вопросы. Есть, восстанавливается связь. Набираете, Ида? Это с его стороны или с нашей? С его стороны. Юля, набираешь его сейчас? А? Вернулся? Не вижу, у меня
I'm
на
here.
экране его пока нет. Oh, okay. So, did I understand correct that the 3 ways to immunize is one is parking, like McDonald's, another is mobile brigade, and the third one is when you go inside of health facility, but only for the hours when they are ready to accept you.
Yes. And it usually will be an hours without active patients. Because someone who comes and gets flu vaccine, he is not sick now. I don't want him to be mixed with sick patients. And it's different from any other year.
And where do you vaccinate healthcare workers? For example, it's a doctor who works in the hospital.
The hospital will get him vaccinated. It's not mandatory in Israel. We do ask the staff to get vaccinated. We do a lot of promotion for the vaccination, but it's not mandatory.
Are they vaccinating more this year than the previous year, the health staff?
Yes. People are worried more than usual, and they want to be sure that if they feel sick, it's not the flu, which means it may be the COVID. So we will see a rise in the numbers this year.
You said in the beginning of your presentation that 98% of patients are are receiving the service in telemedicine. So basically either by phone or by digital. How come? How did you manage to do it, and how patients accept this approach?
The patient likes it very much because they are staying at home in their bed, eating their own food, and not in a hospital. Now, what we do is we learned on the population that was sick, that was positive in the first wave. We learned who got hospitalized. So we know who is the target group or the dangerous groups that can get hospitalized, can get worse and worse and then hospitalized. So each day we get a list of all the positive patients, and the computer runs on them, and we know what's the age of the patient and what's his medical status, and we give them 4 categories. The first one is the light patients. We know that they can be at home, and the doctor will call them at the first or the second day for the isolation at home, but they will be okay for the next 2 weeks. And if not, they can call us. We provide them 24/7 telephone center, which they can call us with medical doctors, and we will provide them with answers. Then the second, the third, and the fourth group, we are checking if it will be okay to hospitalize them at home. The fourth group, we may send directly to hospital. And the other groups, we are staying at home, and we will call them each day if necessary. We will provide them with a box with the one that you put on your finger, sorry, the oximeter. We will provide them with an oximeter. Yeah, and with other measurement equipment. and they will report the measurement twice a day, and we will see if it's okay. We also ask them if there's another person at home so they are not alone. And that's how we can keep them at home and not in a hospital, because in a hospital they cannot meet even the family. At least at home, I can be in my room and still hear and see my family members. Just remember that for patients at hospitals, one of the major problems is being isolated from any human contact. It's becoming much more severe and dangerous than the virus itself.
Do you have the mobile brigades of the doctors who are going to patients' homes? And
Yes.
as well, do you give oxygen to the patients to their homes if they don't have the very low saturation levels?
Okay. The answer is yes, but it's not relevant for the COVID patients. We do provide hospitalization at home with all the necessary equipment, but not with COVID, since one of the criteria, one of the things about the COVID is that deterioration can happen really fast. So if a patient needs oxygen, the next phase may be very, very fast. We don't want him to stay at home. If he's in a situation if he's a positive for COVID and needs saturation or need oxygen, then we will send him to hospital. But regarding your question, we can, after he passes the severe part of the disease, let's say the second week, we can take him out of the hospital and put him at home and provide him with oxygen.
Do you have difficulties with doctors agreeing to work in COVID? Or nurses?
I don't think so. Probably it may happen, but it's not something that is discussed. So I think it's a minority of numbers. The doctors, of course, asked us for all the protective equipment. And once we deployed it, then everything was okay. In the community clinics, at least.
What is the most difficult for you as for communication person of working in COVID?
Usually, the messaging is the most important part in any communication task. And here the messaging changes all the time. If we had one message yesterday, we need to update all the people that are getting interviewed that today there is a different message. If yesterday we told people above 75 to come and get vaccinated, today we say, if you are above 65, come and get vaccinated. So our members get confused and our staff get confused. You need to work parallel to the general public and to your staff. And you need to work in few layers of information, either directly from the organization to all the workers, and then via the managers to go down and down and down and make sure that everyone got the message. So the communication part is very hard now, internal and of course external. The people is under a lot of stress. And if you take a look in media researches that were done, you can see that in times of war or in times of really big stress, people need at least 100% more information. First of all, because they need to hear the messaging more than once. So you have to provide it in few ways. Second, they need to hear it in different channels, in the TV, in the newspapers, on the internet, and maybe by SMS, and maybe from their families. Third, the messaging is changing so rapidly, so they want to stay tuned. That's why they will absorb or they will consume at least double the time of media. But the problem is that the level of acceptance, the ability to understand, is cut by half. If we are in a vacation and with no stress, then we really understand what people are talking to us. But under stress, we may lose the ability to understand or to get down to details. So a very big challenge that I'm facing is the need to be very simple in what I'm saying, to repeat it in many ways and on many channels.
How do you consider the overload now in Israel more for primary health care or for the hospital care in COVID?
Definitely,
Не наплыв, нет, нагрузка в работе больше.
Definitely, the overload is in the primary care, in the community clinics, in the physicians, in the family physicians or pediatricians. In hospitals, usually in the first wave, each hospital had 2 or 3 wards of COVID, with, let's say, the largest one had probably 100 patients. But the rest of the hospital was really empty. The ministry didn't allow the hospitals to do unnecessary surgeries because they wanted to keep all the respiratory machines. And people were afraid to come to the treatments in hospitals, so the hospitals were empty. Now as well, yesterday we had the first big rain in this winter. So for sure, in the next week, hospitals will start getting a bit more empty than they are. And only the stuff that works with the COVID will be under a load, but not overload.
Do you allow relatives to come to the patients if the patients are really severe and probably have a chance to die?
Yes, the answer is yes. All the hospitals, or most of the hospitals, even built a room for that. The patient stays isolated, not a mirror, like a window between him and the family, and they can see him. He will be probably under anesthesia, so he will not notice no one. But the answer is yes. And another option is to do it by video.
And you do organize the video connection for the relatives and patients?
Yes, we help them. It's the hospitals do it. I come from a community-based organization, but now with the Zoom and with the WhatsApp video, it's not a technological challenge.
There are some questions from the participants. The question number 1 is from Nadia Binko, and it's about the immunization for the against influenza for kids under 1 year. Is it only inside of the health facilities, or it can be as well by mobile brigade?
No, it's not a problem. It's not a problem to give it anywhere. In the mobile unit, we have all the adrenaline set and everything that is needed, so it's not a problem. Usually when someone comes to the drive-in, the McDonald's, if the baby understands what we are going to do, like he is 3 or 4 years old, then it may be a bit harder to do it in the car, and we ask the parent to take the kid outside.
And you do it outside of the car?
If it's needed, yes.
The next question from the participants is, where did the budget from the influenza vaccine come from? Whose budget it is?
It's a question about all the budgeting of the system in Israel. It works like this, that we get the budget per capita from the government, and we need to use this money also for flu vaccinations. We really need to buy the right amount of vaccination, since you know that we cannot use it next year, but we don't want to be in short, since the public will be very angry with us. So we're trying to create a balance. We are not getting any additional budget from the government unless actually the government gives us some kind of a test or an exam. And if we get good grades, then we get a small bonus of money for our budget, which is about 10% from the costs.
Do you pay additionally to nurses and doctors who are working in COVID?
The answer is no, unless they have a specific mission. Like, if you are a family physician, you work in your clinic, you get the salary that you get. But if you have under your treatment 5 or 2 or 10 COVID-19 patients, then and you do the tasks that you need to do, to call them, to ask them how they feel, etc., then you will be awarded with few more shekels per patient. But I don't think that it's not enough money to be a motivator for that.
If the doctor or nurse got sick with COVID, how do you then allow them to go back to work? Is it with a PCR test, 2 PCR tests, no PCR test, just quantity of days?
In the first months of the first wave, you had to do, after you got positive, you had to do, after 10 days, I think, a test, and another 3 days, another test, and to be negative in 2 of them. From, I think it was June, the ministry decided that you don't need to do any more tests. And after 10 days or 12 days, you can go out and come back to work.
If you are a family physician, do you respond to the phone calls in the evening or during the night, or there is some other service for that?
A very good question. The answer is no. You are not, someone else will pick up the phone for you. The patient gets a specific number with a specific code. So if I'm not a patient, I cannot use this number. Only patients can use this number, and it's open 24/7, and they can reach us whenever they want. We will let know the doctor, their family physician, that they called us during the night, so he can decide if to call them back in the morning. Of course, we will provide them the answers during the night.
So do I understand correct that if the patient is calling at 10 o'clock in the evening to his family physician. The family physician has a right not to pick up, and then the patient has alternative number where some doctor will respond, correct?
Yes, but the patient does not have the cellular phone of his doctor, but he do get the right phone number of our center, call center, and the doctor that will answer him in the call center will bring up on the computer all the medical file, so we will be able to respond to the call.
So even in the daytime, the patient doesn't have the mobile number of his family physician, correct?
Correct.
When you give oxygen concentrators to the patients to their homes, кисневий концентратор, це зветься, Олег. Кисневий концентратор. So is it a usual practice? Is it possible? This is the question from the participants. Can it be used without a doctor at home?
I don't remember the specific protocol, but there are specific protocols for each situation, and we are following it. I don't remember the data about this one.
What if you can remember, since you are not a doctor, but you're working in Maccabi for so many years, so you probably know, what are the exact indications when you take a decision for hospitalization in COVID?
What we're looking for is, first of all, the symptoms that the patient is reporting on, and then what group this patient is a part of. If he is 25 years old with not background medical condition, with a big family around him, and is just suffering from fever, we will advise him to stay at home. But if it's a 90 years old patient living alone and he's positive, we will advise him or even urge him to go to be hospitalized. So these are the two corners, but you can understand.
I promised to let you out at 1 o'clock, and now it's 1:07. So I apologize for the delay.
Yes.
Thank you very much. And I really liked all the mobile brigades and all the McDonald's vaccination.
Thank you, Katya, and thank you all. Again, I think that this time it's like a war with no foe and a war with no countries fighting against each other. Everyone is fighting the same enemy. So we are all together in this boat. And Katya, if you will do it again and I can assist in any way or learn from you, from your experience, I will be more than glad.
So hopefully we will see you again soon. Thank you very much.
Thank you. Bye-bye.
І ми підключаємо. Чао, Іда, чао, Легітра.